Good morning and welcome back to the iHealth channel and iHealth Radio. This is our first broadcast and our first show in 2021. So first of all, first things first, Happy New Year, everyone. Hopefully the new year comes in with everything that we always want: prosperity, success, health, better, world peace. Obviously everybody's got great wishes and we all have our own resolutions. And so today's show is World Health, and we have a special guest, a very prominent special guest in the healthcare world. And straight up from Canada, I have with me today Stephen Skyvington, and he is a lobbyist, a healthcare expert, the president of PoliTrain Inc, a company that actually deals with healthcare and healthcare concerns in Canada. Very, very active in the healthcare system in both the Canadian side and the US side. And today, what we wanted to do is to kind of bust the myths of the healthcare systems in both countries, because for the most part, in the US, we all think that, hey, Canada's got the best system out there. And we think that we have a good healthcare system, and some people may, really not agree to that particular note. And so with our expert today, Stephen, we're going to talk about, all these things and his opinion and his experience. He's been around, for many years doing this. He knows a lot of this stuff in terms of how the healthcare systems and how it potentially should be. So we're going to hear from him as the expert. But he also has a book that he published. This May Hurt a Bit. That's the name of the book, right, Stephen?
Yes.
All right. So with no further, comments and intro, I want to leave the best, to you, Stephen. Tell us a little bit about who is Stephen and where it all started, a little bit about the company, and then let's talk about the book, and we'll take it from there on busting those myths about the healthcare systems.
Well, thanks for having me, and hello to everybody. In true Canadian style, I had to go out and shovel snow this morning before getting ready for this. So I know a lot of people think we live in igloos, which is not quite the case, but it definitely did snow very heavily this morning. So I turned 62 on New Year's Eve, so I'm now apparently my bad heart is still working after shoveling heavy snow. So fortunately, unless it helps the rating, I'll try not to drop dead on the show here today. I'm kind of an example of what happens. I tell kids when I talk at universities, I'm an example of what happens when you go to university without a plan. I was actually trained as an artist, commercial artist in high school. And by the time it came for me to go to school, college or university, there wasn't anything for me to learn on that front because I had such a great teacher. And so I went to university, not with an idea of getting a degree so much as exploring various things. And along the way, I've had, a totally accidental career. I was an early word processor. I got a 1-week assignment at the Ministry of Agriculture, which led to a career in government. I ended up hooking up with some political types and learned from the best on door-to-door street combat politics. Accidentally ended up becoming the lobbyist for the doctors. So, I sort of say Pierre Trudeau, who is the prime minister father of our current prime minister, Justin, I say, if you looked at the first 46 years of his life, you'd say, what on earth is this guy doing? And then, of course, he gets elected as an MP at 46, becomes the Minister of Justice. At age 49, he becomes the prime minister. And then for the next 16 years, he's the prime minister of Canada. And it's like, oh, now I know. So I'm sort of like the accidental career where all of these different skills and experiences have come to lead me to what I'm doing now. And, I've been very fortunate. I've sort of worked I refer to working in the Ontario Medical Association laboratory, where I had lots of money. I was the doctor's lobbyist. I was able to try a lot of things. We used to take docs down to Washington for campaigns, election school, would have them run for office. So the company, PoliTrain, which interestingly enough was incorporated on Halloween 2001. I have a lot of funny dates. I began writing the book on, I began writing the book on Halloween, I guess it was 2018. finished it on April Fool's Day, and then it came out on Groundhog Day. So I'm not sure the significance of all of those different dates, but suffice to say that I've been at this a long time. And PoliTrain, of course, stood for political training. And the idea was that we were going to train people to run for office. We were going to train CEOs not to get in trouble, not to have crises. And of course, what happened, we discovered the CEOs would just get in trouble and hire a lobbyist and try to get out of trouble that way instead of preventing it in the first place. Sort of like our healthcare system where we're dealing with sickness instead of preventive and wellness and healthcare. So from that, we ended up doing a whole bunch of things: crisis management, ran job actions, a couple of very famous job actions for the police up here. Have done the crisis management where a colonoscopy clinic gave hepatitis C to 3 patients, and I had to help shut that problem down. So lots and lots of experience like that over the years. And I was always the ghostwriter, the guy who would write the articles, write the press release, write the speeches for clients. And then a few years ago, someone said, well, why don't you do it under your own name? So I started writing op-eds. I started giving speeches. I'm all over the internet now. Was doing a weekly radio show for 5 years, and kind of reluctantly became a personality, or a social media personality, a mainstream media personality. And I sort of refer to myself as the old guy because at this point I pretty much am. And I like to say I've forgotten more than a lot of people have ever known, or I've made every mistake that you can make so I can save clients time and money. But the healthcare was definitely an accidental career. So what I've been able to bring to it is very much not like a policy wonk or a professor. And in fact, when you read the book, you'll find that the book is actually quite funny because I have a lot of my war stories in it. I'm like the war correspondent who comes out of the jungle and says, this is what I've seen in the last 25 years, which is as long as I've been doing this. Or, the canary in the coal mine who says, I've been a patient. I've dropped dead a couple of times in the last 5 years. I've been a caregiver for my various family members. I have been a lobbyist. I have been, a public figure. I have been behind the scenes guy. And, I'm able to bring a perspective, and we'll talk about this today, that we're spending a lot of time on the wrong things. A lot of the arguments we're having, a lot of the debates we're having are not the right debate. And I'll explain why it is that we've gone down this road and why history keeps repeating itself, and what we can do to identify not just the political problem, but the real problem, and come up with solutions to what are the real problems instead of the wrong problem. Because the reason we've ended up with what is essentially, I like to refer to it as an insurance scheme and a sickness system, is because we've identified the wrong problem over and over and over again and come up with solutions to the wrong problem instead of the right problem. And that's how we've ended up in the mess we're in. Ironically enough, COVID may have a silver lining, because I talk in my book about 2030 as being the year in which the healthcare system will collapse if we don't do something about it now. And it's interesting because the media got all distracted by the whole debate on the environment and how little Greta Pigtails and her campaign, her PR campaign was well funded, saying the world was going to end, next week kind of thing with the environment. Well, by not going to work and not shooting all these emissions out into the world, the environment's actually in good shape right now. But healthcare is about to collapse because of COVID, and all the ICUs are overflowing, all the hospital beds. So if there's a silver lining to COVID, the politicians can't hide for another 10 years. We really have to deal with this now. And I will talk about some ideas about how we might deal with that, and how, in fact, our healthcare system, to me, is the greatest challenge, the greatest crisis that we're dealing with, way more than the environment.
Well, it is, and obviously, health is an important component of life, right? We need to maintain a healthy, living, a healthy body, a healthy mind, and all that. And to your point, also, COVID has shown how vulnerable we are as humans. I mean, in face of a small, bug, and the whole world has shut down, or almost shut down. So it's important. And, to tackle that, we've seen how some of the healthcare systems have crashed in light of what's been going on the last few months. And it's actually re-happening right now. I mean, in some states, for example, in the US, they're facing the same challenges they faced a few months back when, the hospital system cannot sustain and so on and so forth. So it's all happening. But there is a structure or infrastructure behind all this. But before we discuss the piece of it in the US, for example, why don't we go a little bit and talk about, I know in one of your articles you discussed, the Canadian system and that is not any more sustainable. To your point, you said in 2030, you're not going to have, the system will crash, period. And so what is that vision? What is that? Why is it happening?
Well, the reason why we've ended up with the system we've ended up with was because a fundamental mistake was made in the 60s when Justice Emmett Hall was asked, actually even in the late 50s by Prime Minister Diefenbaker, to have a royal commission looking at our healthcare system and how we would create a integrated system that would work for everyone. And unfortunately, the problem they determined needed fixing was how do we keep people from going bankrupt and losing their homes and everything they have when they get sick. And so let me just take a sidetrack here for a minute. Dr. Minbassador, brilliant man, he's an engineer, created a system called Simplexity in which allows you to identify the real problem and to have a solution for the real problem. So the real problem that Justice Emmett Hall should have been working on was, how do we keep people from getting sick? How do we create a wellness system? How do we have a system in which integrates all primary care and hospitals and specialty care? But what we ended up with was an insurance scheme, which became Medicare. In Ontario, it's the Ontario Hospital Insurance Plan, Ontario Health Insurance Plan. And so what we've ended up with is a system that is a system that is really built on waiting. Okay, it's rationing healthcare. And, we talk about in the US, healthcare is rationed by the size of your credit card. In Canada, it's rationed by the size of waiting lists. And interestingly enough, they brought Justice Hall back in the late 70s to look at how healthcare was doing, and there was like extra billing and co-payments and stuff. So he made some suggestions, which ended up becoming the Canada Health Act. Now, the Canada Health Act, which I'm sure you've heard of, that's basically our Second Amendment. That's our right to bear arms. Okay, in the same way you guys go nuts about the right to bear arms and having guns, our people up here go crazy about what is actually a finance bill. When I was writing the book, I actually learned some rather surprising things. It came out, interesting enough, on April Fool's Day, 1984, the Canada Health Act, and they have the five principles. Tommy Douglas, the Premier of Saskatchewan, often erroneously referred to as the father of Canadian healthcare, father of Medicare, he had 8 principles. The 3 they jettisoned were efficient, effective, and responsible, which I would argue are pretty important principles. I, of course, argue for how come quality isn't one of the principles. I would like quality to be a 6th principle. The reason being, when I was on the waiting list for my heart and needed an operation, if I had died on the waiting list, that would have been viewed as every bit as successful as if I'd been treated and had an operation and a good outcome, because it would have moved the line along one more body. Nobody cares about quality. All we care about is moving the line and how long is the line. We even, insanely, in Ontario, we had a healthcare minister who thought it would be a great idea to deal with waiting lists by having a website telling you how long you were going to wait, as if that was somehow solving the problem. I mean, this is the lunacy that we end up with dealing with. But why I make the point here about solving the wrong problem, why this is important. History keeps repeating itself because I think it was James Joyce said, those who don't learn from history are doomed to repeat it. And that's exactly what we're seeing now with pharmacare. So in Canada, everybody's bent out of shape about, well, we have to have a pharmacare program because people are having to choose between paying the rent and paying for groceries or being able to fill their prescriptions for pharmacare. And so we're going to end up with another insurance scheme to pay for prescriptions that's going to be just as ineffective at keeping people healthy as our Medicare system. And the reason being is the question we should have been asking and the problem we should have been working on, why are we on all these prescriptions? And I would argue, and I go into great detail, and believe me, I've been committing suicide with food since I was about 5. So I'm like maybe the last person you should be taking nutritional advice for, unless I'm kind of the before picture and the healthy person's the after picture. But we are just killing ourselves with our bad food choices, with sugar. There's all lack of exercise. There's the whole thing. I do talk about some of these things in the book, but these are the questions we should be asking. If you want to have a healthcare system, it's got to have a lot of wellness and preventative things in it, not simply somebody sick, somebody overeat. Again, I talk, and this is going to be way worse than COVID. The 3 healthcare tsunamis, dementia, diabetes, and obesity. Any one of those 3 is enough to wipe out the treasury. And even worse, it's the hours that are taking people away, the unpaid hours people have to take away from their jobs. So it affects productivity, affects their pocketbooks to look after someone who's sick. The great cost of dementia is not the cost of drugs or not the cost of trying to house somebody. It's the cost of the children or the spouse having to look after the patient, because really there is no plan. Canada has no dementia plan, believe it or not. We don't have a strategy. And this is my problem with the COVID response. This is now really the 4th such, if you want to call it a pandemic or mini outbreak, whatever, since 2020, since 2000, last 20 years, we've had SARS, we've had MERS, we've had H1N1, and now we've got COVID. And there was no plan. And what you've got right now, you're witnessing politicians who come up with plans on the back of envelopes and trying to solve the political problem. And this is the great danger. I keep saying, okay, if you're going to list how many people you tested for COVID, and how many people got COVID, and how many people have died of COVID, how many people are in ICUs, you should be listing how many people lost their job, how many people's company went bankrupt, how much spousal abuse is going on, how much suicide is going on. Because these numbers, how many cancer surgeries were canceled? How many, whatever it might be, whether it's chemotherapy or whether it's heart, whether it's people not going to the hospital because they're scared and they're going to get COVID in the emergency. Where are those numbers? Because I would argue that our leaders probably made the wrong decision shutting down the West like they've done, the US and Canada and Europe. I almost would have liked to have had a referendum, some kind of debate, some kind of input from the public whose lives you have now destroyed. And this whole business about we're all in this together. Well, we're not all in this together, because some people are working from home, getting their full salary, their full benefits, their full pension, and other people are losing their businesses because of decisions being made by those people who are getting all this. And so my point is, we end up with a catastrophic healthcare system on both sides of the border because we have over and over again solved the political problem instead of the real problem. And I would say I have some sympathy with politicians because they've only got 4 years between elections to come up with what is really a plan that would take 10 years to work. We need a 10-year plan, okay? I almost sound like communist Russia times 2 with their 5-year plans. We need a 10-year plan. And the politicos try to do the tough stuff in the first year. Then they try to see if it's working in the second and third year. And then they hand out the election candy in the 4th year. So there is no 10 years to fix our healthcare system on their schedule. We're also to blame because we do this. We say, okay, fix our healthcare system, fix hallway healthcare. And by the way, give me some candy and I'll vote for you 4 years from now, okay? And, hallway healthcare is another great example of fixing the political problem. People, I think, are aware of the concept of bed blockers. These are people that are in the emergency ward of hospitals who shouldn't be there and in their hallway. And so the political solution, we've seen this in Ontario with Premier Ford, throw money at the hospital to open more hospital rooms to get people out of the hallways. Hey, problem fixed. Well, no, you didn't fix the problem. They did a study, which I talk about in the book, and they discovered that, I forget what the number percentage, most of the bed blockers were either dementia patients or obese patients. So we don't have the machinery to move obese patients around without blowing out the backs and knees of personal support workers or ambulance paramedics. Mm-hmm. And we don't have the necessary tools in the nursing homes to deal with dementia. Most nursing homes do not have the stuff that they need. So by fixing the political problem of moving bodies out and not understanding that I believe it was 9% of the bed blockers were causing 44% of the bed blocking. The numbers are something like that. So that's the real problem, which doesn't get solved. And this is frustrating to me because we get into these crazy debates, like myself and Dr. Brian Day, whenever we say, we need a hybrid healthcare system, a mix of public and private. Well, people start waving this Canada Health Act around like it's a flag and, oh, we're unpatriotic and we're bad people. And my argument is, if you're gonna be waving the flag and supporting the status quo, you're going to end up with exactly what you say you don't want, which is a U.S. style to your healthcare system, because that's where we're going to end up unless we admit now that what we have isn't working, and we need to embrace the hybrid system. So
you've made, there's a lot of stuff that you've discussed right now in this particular segment, and the first thing, and it is a perception, is in at least from the U.S. We feel that, okay, Canada has the system that works, and everybody has access to healthcare, and you can always, there's coverage, you don't have to worry about it. You mentioned that, it is the Second Amendment for Canadians, and that kind of level, right? Which is what we think, and that's what the perception is. You clearly are making the argument here that it is not exactly what we expect it to be or what the perception is. And to your point, if people have to wait, and I've had these conversations with few friends that are from Canada, and they do actually always state that for the average person, they'll have to wait. I mean, there are certain side insurances and things like that. You can get yourself into a primary doctor or somebody sooner than waiting on the regular, list and things. But to your point, it is not a general concept, and therefore only the few can, afford to do that. And also, it takes a lot of toll on the taxes, right? I mean, I know I've visited Canada many times. I mean, I lived actually in Niagara Falls, the U.S. side for a minute. So we were there all the time. And the amount of taxes that you spend on anything that you purchase there, I mean, a lot of it has got to do with the healthcare. I'm assuming that is the correct, answer. Mm-hmm. So ultimately, it is not the best formula of healthcare. And there is no real plan, and there should be a plan for, to transit it to a better hybrid format. Not necessarily like the U.S. Again, in the U.S. is a little bit different. And I know you had some articles that you've, or interviews that you had about, how should the U.S. system be, and is it ideal? And then also you've addressed, Bernie Sanders, in terms of the social system, or at least the Medicare for All concept, which is not really, it's similar, because I think that's what he's been, invoking as a Canadian system as the example or the sample to follow. And yet, it is not. And so with those types of elements that we're discussing right now, I mean, there's a lot of question marks. And you mentioned about folks being, obese, diabetic, and also dementia. And to your point, these are three things that are, chronic, they don't go. And we've seen them, they're here, then they're not going anywhere unless you actually address them. Me personally, from my experience dealing in the insurance world in the US, those are, I call them three stooges. They come in usually together, and there's not much you can do. And the cost of home care or caregiving, that goes along with some of these things, the cost of medicine, for example, for diabetes is, is expensive. My mom is diabetic. As a matter of fact, we're talking potentially to do a show about diabetes soon. And, the prescriptions that she takes, the insulin, I mean, one vial is about $300. That's how much, it costs. I mean, ultimately we have insurance for her, but, you still have to buy the insurance. and it's an ongoing cost, right? So those are things. So there is no, unless you can afford things, it's a problem. And there is the other variable where sometimes you don't have enough money, and therefore you fall into a certain poverty level, and therefore you qualify for the standard Medicaid or government programs. So again, there is also disparity between who can afford, who can't, and then everybody else, to your point, the people that have to go to work, and or small businesses that may not be able to afford, commercial insurance. So there's a lot of different questions here, a lot of different, we can isolate each one of those items separately and spend an hour to discuss. So let's talk about how you see, ultimately we talked about the Canadian side. Now let's talk about the US. How does that compare, from your perspective?
Well, let me, as I get there, share a couple of other things that I think are important on the financial side. We will, by 2030, which is why, and that may be speeding up now thanks to COVID, we'll be spending 80% of our budget on healthcare. So that means if you're okay with having every school will have to be a private school, every road will have to be a toll road, there'll be no money for government services. The former Premier of Ontario once said, there'll come a time when 100% of the budget goes to healthcare and we still won't have enough money for healthcare. And, or as a friend of mine said, we'll only need two ministries, one, a Ministry of Finance to write the check and Ministry of Health to cash the check. That's where this is going, okay? Number one. Number two, and this is the shocking thing, I'm using Canadian numbers here, but this is going to be relevant ultimately for the States. Young people will say, I don't need to care about healthcare because I'm young, I'm healthy. I'll worry about that 20, 30, 40 years from now, okay? I could certainly make the argument that's not true. It's some of the physical shape young people are in. Their wrists are in great shape from all the gaming, but the rest of them not so much. But this is important. As a boomer, a baby boomer, I will receive $4,000 more health care in my life than I paid for with my taxes. A millennial will pay $18,000 more in taxes than healthcare received. And the iGens, and this is really alarming, will pay $27,000 more in taxes than healthcare received. Now, that would almost be sustainable if we had as many millennials and iGens as boomers, but we haven't produced enough of them. They're living in their parents' basement. They don't have a full-time, often they don't have a full-time job with a pension and benefits. They're working some part-time jobs. It's the president calling to complain about what I'm saying.
That's all right.
So financially, just from a financial point of view, this is unsustainable. But even worse, and this gets back to the wrapping the flag in the comparison of the two countries. So one of the studies showed that Canada was rated 30th, our healthcare system, and the US was 36. So one of the things you'll often hear is that Dr. Day and myself and others who are looking at things like a hybrid system, we want to basically have a US system. That's our end game here, is to bring a US style system to Canada. Well, why would you want to replace the 30th system, which is pathetic enough being number 30? I don't think it's one of those foam fingers that says we're number 30. Why would you replace that with number 36, first of all? The other argument is, oh, well, you're just about creating a hybrid system for the rich. You just want a second tier for the rich. Well, the rich already have that in Canada. It's called America. All they have to do is go to America, hop on a plane, whatever, and they can get that other tier. But frankly, two tiers would be a huge improvement in Canada, because we have, I think it's about 14, 16 tiers.
Wow.
We have the workers' compensation tier, we have the politicians tier, the military tier. We have all of these different systems where people can jump the queue, and the Friends of Doctors tier. Our prisoners have better access to healthcare. My wife is always threatening to murder me in order to get healthcare and a much better life, the 3 meals a day, the giant screen TV, but even more important, healthcare paid for. They don't wait in line. They're allowed to jump the queue. Like how crazy is that for a system? And that's what we have here. in the case of the States, like I watch, obviously, my doggy pups and I like to sit there and watch CNN and all the other shows and Fox and watch the debate going on in the States, and it's always amazing to me to sort of see, it's one thing to see the Second Amendment, the whole gun argument, which we could spend lots of time talking about that, but just sticking with healthcare. And you're right, it's almost this zombie-like, um, Canada is the holy land, the holy grail. And if only we can import what they do in Canada. They even brought Dr. Daniel Martin down to the States to talk to the Senate. I believe it was the committee looking at the Affordable Care Act. They brought Bernie Sanders up to Canada, which I talk about in the book, and gave him a tour of the hospitals, which was like taking a little child around on Halloween and putting candies in their little satchel there. It's just infuriating to me, and especially living in a time as we do, in which the media, there seem to be no investigative reporters anymore. The media just takes whatever people say or these briefing notes or fact sheets and just assume that's the way it is and you don't need to do any digging. And I was laughing when the judge came out and found against Dr. Day's charter challenge on bringing that it's a right to, if the government can't provide the service, you have the right to pay for it and not have to wait on a waiting list. And people were cheering because the judge said, "Oh, no, status quo. We're going to continue with what we've got." And I thought, like really, people, like you're so ill-informed that you're cheering what 10 years from now or less is going to be catastrophic for you. And so, in the case of the States, I say this about both. I know in my book I made 10 suggestions, and in the article that you referenced, How to Fix the U.S. System, I made 5 suggestions. First and foremost, in both countries, I say, politicians, please stop lying to us. As I referenced earlier, I turned 62 a couple of days ago. And I've really come to the conclusion that virtually everything we've been told has been an out and out lie. And, whether it's finding out about Pearl Harbor in 1941 and all these years later, we discover that we were actually lied to about what really happened there, whether it's who killed Kennedy, whether it's 9/11, what happened there, whether it's even ultimately has stuff starts to dribble out about COVID. We could certainly do a conspiracy show. No one enjoys a good conspiracy more than I do. We could do an entire show on the origins of COVID. But just focusing on healthcare, the lies have just been incredible, and the misdirection. And by the way, like, I'm a spin doctor. I mean, I'm a professional liar. I know when I'm being spun. When I was referencing Greta and the whole environmental movement, that to me is one of the worst cases of child abuse I've ever seen, because she's being used by her parents and the people running that $1 billion campaign. And I feel absolutely sorry for her, to be honest with you. But that seems to be the norm nowadays, is that we have the media, the Main Street media, who seems to have given up any sense of investigative journalism or integrity. In Canada, they just got bought off by the government, and so they're not going to be saying anything about the government. And then, of course, social media. Social media is a very interesting animal to me, because you've got, on the one hand, politicians using social media, in fact, using it to give the illusion they're still in the country here when they're actually taking a vacation during COVID down south. We just had a couple get caught doing that. And they're doing the I'm going to read your Christmas story by the fireplace, and we're going to put it out on Christmas Eve. While meanwhile, you've been down south for 2 weeks. So we've got politicians misusing social media. We've got people with I believe we learned about this 20 years ago at campaign school. AstroTurf campaigns as opposed to grassroots campaigns, where you have kind of a fake grassroots who say they want this, that, and the other, and in fact, it's bought and paid for. So, believe me, I wrote the book on this stuff. I've used lots of this stuff over the years, but what I'm telling you about healthcare is the real deal. Okay, as I say, I've dropped dead twice in the last 5 years. Fortunately, I'm the doctor's lobbyist. They keep bringing me back to life and finding ways to keep me alive and ticking against all odds. How I'm still alive, I tell the story in the book about after I had kidney stones, and the nutritionist said, "How much cheese do you eat?" And so I told her, and she said, "Is that a year, a month, a week?" And I said, "That's a day." And she looked at me and she says, "I don't understand how you're still alive." And frankly, neither do I. But we've got to stop this lying. We've got to stop this massive game of pretend. If we could first and foremost do that, then I think we'd be well off to the races as far as solving this. Because again, this obsession with solving the wrong problem and solving the problem that ultimately is a political problem, it is not going to do any good. We have to solve the real problem, but you can't solve the real problem unless you can identify it, which is why, Dr. Bassiter's Simplexity program, I urge anybody watching to go and check it out. It's a phenomenal way of, it's actually a thinking system. It'll teach you how you think. There's actually 4 thinking styles. I'm number 3. But more importantly, it helps you identify what's the real problem. And in the case of healthcare, let me just put this in terms that people might understand that are not healthcare terms. So everybody knows the soap Irish Spring, the green soap with the green stripes, right? So they had invented Irish Spring, and Min was a young engineer for Procter and Gamble who suddenly was, Irish Spring was like just eating their profit. So he was told, the people were instructed, come up with a green soap with green stripes to compete with Irish Spring. So that was the problem they were working on. And eventually Min said, well, you're actually working on the wrong problem. And so he got them thinking about what people would like with the soap. And they talked about, well, I go to the beach and I relax, and there's the blue water and the white sky and all this. So eventually they ended up with a soap called Coast, which people will probably remember, a white soap with blue stripes, which ended up outselling Irish Spring 3-1. So once they identified what the real problem was and came up with a solution for the real problem, they solved the problem, but they had been working for months on the wrong problem. They didn't need a green soap with green stripes. Irish Spring already had one of those. So this is the problem with healthcare. And as I watch the debates, and I watch them, and people, of course, their eyes glaze over, because when you start talking about insurance schemes, you start talking about deductibles, you start talking about, okay, I can't afford to leave my job because I've got healthcare insurance at work, and I'd be putting myself in danger, and so on and so forth. And then there's this, okay, Medicare, the Affordable Care Act, you can sign up and this, that, and the other, and so on and so on. And it's really complicated. And you can make something that's simple sound complicated, and something that is complicated, which you should be making sound simple and getting right to the root of it. That's the problem, is we end up with partisan attacks on each other, which, I was speaking earlier before we went on the air about, we live in an age where people think things are black and white, blue state, red state. Even in Canada, where we have multiple political parties, it's really left and right, conservative, liberal. And the fact is, the world is got lots of gray areas, okay? And the gray areas, which used to be known as, where we would compromise between the left and the right and the black and the white, people now, you have a tragic situation right now in the States as a result of the election, where, I mean, frankly, I think you're on the verge of a civil war, depending upon what happens this upcoming week with trying to certify the vote.
Hopefully not.
You've got half the people say, well, I'm Trump, and half the people say I'm Biden. And there seems to be no middle ground here, which is super dangerous. And even the numbers, I know Biden's ended up with 4 or 5 million more votes, but 75 million people voted for Trump, for example, or for whatever it is they thought they were voting for by voting for Trump. And, the people who voted for Biden, certainly a lot of them would have voted for Biden to get rid of Trump. I understand there's a lot of voting against, and we have lots of that in Canada as well. So we're in a dangerous spot, because the spirit of compromise and multi-partisan and working together across party lines in both countries, really in all countries, is catastrophic. And you've just really witnessed the attempt to do that, and we'll see how successful that's been with Brexit in the UK and the EU. Will what they've come up with actually now work? But in the case of healthcare, can we be honest and just say both our systems don't work, that both our systems need to be redone? And, people will say, well, what system should we copy? And someone wrote an excellent book in which they looked at every healthcare system in the world and took a bit from here and a bit from there. They had about 25 different systems to create a new system. I believe we have enough smarts in our two countries to invent our own systems that will actually solve the real problems and that will help us move forward in a way that helps the people, looks after the people, but addresses this issue of wellness and health and prevention, because we are not doing it. If you're going to eat yourself into a coma, if you are going to, I understand if you're suffering from diabetes, you need insulin. I mean, it's not like that's a lifestyle choice. It's not like somebody had too much, drank too much pop or ate too many chocolate bars. You can be born with diabetes, but you think about the lifestyle choices of drinking pop, for example, and fast food. These are things that we actually have some say over, and yet I'm looking at for me it's probably too late, but for the children and the grandchildren, we still have lots of time to fix these things, because if we don't, as I said, just dementia, diabetes, and obesity alone, any one of those three will be enough to collapse either of our systems. We're not going to be able to deal with them. So it's really super important that we stop the lying and have an honest dialogue.
So definitely, and you've mentioned the example of a new and improved system that both countries can potentially put all their top-notch people on it and come up with a formula that works. Despite the fact that someone did write the book of multiple systems and maybe hybrid them all together in one place and maybe had different concepts. What would be the ideal ingredients of that healthcare system that, if we were to come up with it, it will be good for all? So I know you've alluded to a few things. One is quality, service, access. Those are some of the things that we would all want to have. And also ease of access. Coverage in all aspects: hospital, provider, primary, pharmacy, all that. What would be your formula? Like if you were to give a suggestion, and I know you've given some in the articles and those things that you put in, what would be those criteria?
Well, again, because COVID is so in the news right now, and it's really shone a spotlight on one of the major problems, which I've talked about, is long-term care. And, I say invest heavily in long-term care or be prepared to pay the consequences. So we need to have a discussion here. We have become a society here in the West that basically warehouses our seniors, warehouses our problems, that, not probably in a nefarious way, but in just kind of a perhaps thoughtless way, we think it's okay to put mom and dad in a home, and it's now, we're paying money to the home and it's their job to look after them. Okay. And now, thanks to COVID, we're getting incredible horror stories about what's going on. And it's interesting because, for years, the flu has been the dirty little secret. The flu has been actually knocking off seniors for years at this time of year. And that's what has solved the lack of bed problem, that the seniors die and now suddenly there's an opening at the hotel. But we have to, I didn't put either of my parents into a home. I actually moved from downtown Toronto out to this small town here where I am to look after mom after my dad died. And I did that for about 6 years before she eventually died. And I know I've got a friend who runs his own business from home, who looked after his mom for about 10 years into her 90s, and she had all, cancer and heart and all kinds of problems. And, he made the decision to do that. And I understand that's a difficult decision for a lot of people, but our home care, long-term care facilities, I think we're something like 30,000 beds in Ontario short. Ontario is a province of 11 million people. It's going to take 10 years to get all those beds built, all those facilities built. And again, we still are not going to be able to deal with the obese and the dementia patients unless we actually build that into the homes. So, long-term care is an extremely important component of rebuilding a healthcare system, because frankly, the boomers are just starting to arrive where they're going to need it. And there are lots of boomers, and they're still alive. And they've actually, a lot of them, we call them Zoomers up here, the ones who've really embraced healthy lifestyles. And so they're going to keep it going for a long time yet. And so to simply, the shocking numbers I gave earlier that the millennials and the iGens are going to be dealing with, and that they're in no shape to deal with. I said it's an accounting problem. A friend pointed out it's actually an actuarial problem, and this is going to be so problematic. But I think if I could pick one other thing, it might well be. We have ended up with healthcare in both countries, and this is in which case we're kind of similar. There's nothing wrong with the healthcare. The healthcare is excellent, but it's really unsustainable. In Canada, it's unsustainable because the wait lists are just growing and growing and growing, and the Treasury. In Ontario, I believe my province, we're, I believe, at 50%, 47%. We're probably going over 50% of the budget right now is healthcare. That, which is stunning, isn't it? As I say, that'll be 80% in less than 10 years, probably 5 years now. But it's not the quality of the healthcare. It's that we are ending up in a situation because of technology, because of new treatments, new drugs. We just can't afford it. And here's a big part of the problem. We as patients, accepting this business about politicians, fixing political problems and throwing us candy, and then we vote for them, okay? Well, there's another problem, and we're seeing it during COVID. Healthcare workers, the doctors, the nurses, the pharmacists, all of the people involved in giving us healthcare, delivering healthcare, you wonderful folks are to blame as well. Because unlike real humans who are like us, who would simply say enough is enough, you're the one to stick your finger in the dike to keep the dam from collapsing on all of us. If you had just simply let the thing collapse 20 years ago, like a normal person would have, we would have been forced to have this debate, and we would have been well on our way to fixing it. But because, you're incredible heroes, and I say this, I've obviously worked with doctors for years and nurses. You folks are great heroes, but you're giving the politicians an easy way out. You're allowing them to spout their BS, that they have fixed the system, that they have a plan, that we are well on our way to whatever, when in fact, none of that is true. And as COVID has proven, when you come up with a plan on the back of an envelope, we're going to be dealing with the financial and the mental health. We have a whole generation of kids that are probably destroyed now. The ones that have been forced not to attend class, who've been, trying to do the learning. I understand that there's now like a cheating epidemic of homeschool. That there's no way for the kids to write a test without cheating now because of the way it's set up. But you have just created, without really thinking about what you were doing, incredible problems. The mental health, that's going to be a huge one. Yeah, it already was getting out of control, but mental health is going to be absolutely full-blown crisis. And not just because of COVID, but COVID is basically sped things up here dramatically. So in trying to fix the healthcare system, we need the doctors and nurses and pharmacists and people in the system to come out and be able to tell the truth without being punished. And I know it's both difficult for them to say what's really going on without being punished. And it's also difficult for them to do this because it's not in their nature. They're very different people. I talk about, in the book the history of doctor bashing here in my province. And, doctors have always been very convenient to bash. And then suddenly when there's a crisis and you need them, they're, well, we love our doctors sort of thing. But this is what politicians do. And it's really important that if you're, the individual choices or mechanics or components of a healthcare system, they don't matter nearly as much as the spirit of what you're doing, the honesty of what you're doing, the trying to really genuinely help people as opposed to figure out how you get votes. Okay, so I said you really need to take the politics out of it. And unfortunately, we have seen the politics are getting ramped up even more so in the debate, and it's going to be even worse. I'm watching with interest your election on Tuesday night to see who ends up with control of the Senate, and whether it's the Democrats or the Republicans. It will have an effect on a bunch of decisions, including a bunch of decisions about healthcare. But lastly, let me just make this pitch, because obviously coming on your podcast and other podcasts and other interviews I've done, which I'm really grateful for, that people give me an opportunity to present perhaps an alternate point of view. I would love, if anyone's out there who can get behind this in any way, to create an Institute of Healthcare Reform and Innovation. And I've never saw it as being a bricks and mortar sort of thing. I would like to be able to be in a financial position to spread this message to, ironically enough, COVID made it really difficult for me to go out and do book signings and speeches and TV appearances. But we certainly, I think, have overcome that with various ways of using technology like we're doing today.
Sure.
But financially, for some kind of assistance to get out there, and of course, I would very much like to write a sequel. And the sequel would be the actual book is This May Hurt a Bit, Reinventing Canada's Healthcare System. The sequel would be If It Ain't Broke, Fix It: Myths, Barriers, and Breakthroughs in 21st Century Healthcare. And what I would do is look at the world, look at what other people have done, talk about the myths, talk about the breakthroughs, and talk about how we might create these new systems, a new system, multiple new systems, in which we actually try to solve the real problem, that we stop lying, we take the politics out of it, and then we can get down to the nitty gritty. Like I'm not a policy wonk, I'm not a professor, I'm by no means the smartest person in the room. We have lots of smart people in all the countries who can come together and work together in a spirit of unity and create something magnificent. But we're never going to get there if we don't admit the truth, and if we don't start solving the real problem and identify the real problem, and ultimately just turn down the volume of the political rhetoric and work together, that it's not black and white, left and right, blue and red. We can meet in the middle and solve problems. We still, we're humans. We're good at solving problems. We have solved problems. But what we need to do is identify the right problem and solve the real problem and do something heroic for the people. And so the real heroes of our healthcare system and the whole COVID thing we're going through right now, the doctors, nurses, pharmacists, and other healthcare people, be heroic and join, come and add your voice to this. I know it's quite a cost to speak out, but we really need you to, because otherwise weaselly politicians will simply say, hey, it's working. Look, I fixed COVID. Well, no, you didn't fix COVID. Okay. What you did was you made some really dubious choices that we're going to be dealing with for years. And it's not, saving lives versus the economy. It's not that. Okay. It's all this other stuff that you're now, how is this generation of kids going to recover? How are the small business going to recover? I mean, we don't even know what the ramifications of these vaccines are going to be. And I'm not being a conspiracy theory guy, but, who knows, what's going to happen if you don't have enough vaccines. And so the people who are supposed to get the second vaccine, we take those second vaccine and give it to the people who didn't get a first vaccine. And then what happens? Like, there's just all kinds of questions here that basically, and again, I come from the world of politics. I've advised politicians. I understand, okay, help me survive the next news cycle. Well, we need to get past that thinking and talk about how we're going to survive the next 10 years. Because guess what? 2030 is now here thanks to COVID. So you don't have 10 more years to BS your way through this. You need to get working on this problem right now, where it's going to swamp us way more than the environment ever would.
Well, I mean, to summarize, I mean, there's a lot of stuff, a lot of content, and it's a lot of good advice, and which could be challenged by a lot of folks. They might not see eye to eye to the actual point of view, and certainly some providers would probably buy into it and see that there's value to it. And there have been talks out there and folks that actually do claim, to try to do something, but certainly their voices are not heard. And to your point, also social media is kind of unique, and so some people have the ability to speak about it, but maybe there's not enough impact. So there's that part too. But I think the concern is that everybody's been dealing with the situation, right instantly. Meaning things happen, we fix them. We don't look like, what is let's reset. We don't look at let's rebuild the foundation again. It's just patchwork, and it's just tacking, one over the other. And ultimately it could get to a point where it collapses and crashes, which again, you're predicting. And we've seen that. And to your point, I mean, yes, we do have the vaccine now for COVID. That's great. And there's varieties of them. There's different approaches to them. It is still uncertain as to the outcome or the results. There have been articles that state that maybe it will take 5 years, if more, or or just close to even get everyone a vaccine. And that's if people are, the majority of people may not even accept actually a vaccine. There are people that are anti-vaccine out there. And so there's a lot of stuff. But unless there is a to your point, let's just leave the politics. Let's just worry about the care and talk about the future generation and how between cost, care, system, quality, all that stuff, and put it all in one place. Then finally, hopefully, we'll get a system that is sustainable, successful across not only just the two nations, but I think over the world. Now, I know you mentioned Canada's number 30 ranked, US 36, but there are other countries that may have done it differently, and they've obviously gotten the ranks that are ahead of us. Is there anything in their system that we are missing, in your opinion? Let's say England, Europe, France, Germany, Japan, any of those, I guess, high revenue countries, they do it different in their healthcare system that may be a model for us to look at and say, maybe, well, look at them, they're doing it and it's working. Just like, again, it's the same concept. Well, we look, hey, look, Canada's got it right, and obviously it's not the case, but maybe looking at that, and they could not be necessarily the best, but maybe they have something like an extract that we can use.
The number one thing they have in common is that they allow for a hybrid system, the private-public mix. And I again think that is the number one thing we have to allow for. I believe it was Canada, Korea, and Cuba were the only three that didn't allow this, and now I believe Canada is the only one that doesn't allow for a public-private mix, a hybrid system. And you can look at individual things that the different countries are doing and how they have different programs for how pharmaceuticals are covered and so on and so forth. But I think just the easiest thing from certainly a Canadian point of view would be to allow the public-private mix and get off this. I mean, imagine that a piece of legislation that is basically a finance bill, first and foremost, that they tacked on 5 principles, it is treated as if it was the Second Amendment. I mean, that's insanity. And to accuse myself and Dr. Day and others, people that are in favor of a hybrid system, as being unpatriotic and traitors, and using the Canada Health Act. I mean, it's not for nothing, I think, that it was brought out on April Fool's Day, because it's a really bad April Fool's joke, this piece of legislation. But I just find it stunning that the debate, disintegrates into that all the time, and that that I want a U.S. system, and it's just nuttiness. And as I say, I talk about the law of unintended consequences in the book. where you do one thing, not realizing something else is going to happen as a result. And if we end up holding on to our so-called single tier healthcare system here in Canada, we will accidentally end up with a U.S. style two-tier healthcare system, which frankly nobody wants. But that's where we're gonna go because of the status quo people and the deniers. We have a great healthcare system, but it's unsustainable. That's the problem. It's not that there's a problem with the system; it's unsustainable. If you end up having to spend 80 to 100% of your budget on healthcare, you don't have to be Einstein to realize that that's not going to work. And people just aren't, they say, well, it's free. It's not free. It's expensive and you're paying for it, but you don't seem to realize that.
Well, there's nothing for free. I mean, that's a general standard, but I mean, to your point, I mean, it's not free. I mean, taxes are, it's tax, payers' money. And it just pretty much budgeted towards the healthcare. But to your point, there's got to be a point where, there's no more, and you can't find another way to finance it, and therefore then it collapses, and then you have worse problems because now people are not going to have the access and the medicine and so on and so forth. Now you mentioned the hybrid, which is the core piece that you're pushing in terms of an ideology. Now, some people may argue, and we're almost at the end of the show, but some will argue like, well, that already exists in some point. Like for example, in the US, we can think of managed care as an example of a hybrid, government and private sector, because the way it works is that the government pays, private agencies or private companies to facilitate the healthcare. So, and that's the context of managed care. So a lot of states, especially in Medicaid and in the lower poverty levels type, income brackets and so on and so forth, folks that fall into those categories do qualify for these types of systems, and therefore they're pretty much managed by private entities sponsored or subsidized by the government. And I think some of the discussion with the social Medicare or like Medicare for all was also similar to that concept, or at least touching a little bit on that same concept. But I'm getting from you that is not really what we are talking about here. It's more of a larger scale, not just for a particular group, but it's for everyone. You have private and you have the government subsidizing some of it.
Yeah. Profit is not a dirty word. And there's no reason why healthcare can't be a revenue generator and not simply an expense line on a balance sheet. People like to get bent out of shape about their rights, and they like to say healthcare is a human right. Well, healthcare is not a human right any more than education is a human right. This again is, it sounds really good as a soundbite. Okay, again, I'm in this business. Okay, I come up with sound bites for clients. Okay, but healthcare is not a human right. Education is not a human right. Okay, so you have to understand that, and you have to unpeel that, or open the onion and get to the core of it. I look at, obviously you'd be hard pressed not to see horror stories in the States about cost and people getting caught and trapped in very bad situations. And, you'd certainly want to, while profit isn't a dirty word, you want to make sure that we remember what we're there for, which is yes, to make a profit, but really to serve the customer. And, the customer are the people, and the people that need healthcare. But again, we really need to do some educating. We really need to talk about that there are consequences to bad lifestyle choices that, while it may be too late for, people of my generation, our kids, frankly, I think our kids and grandkids are going to be in worse shape than us, not just for financial reasons, but I look at what they eat. I look at the lack of exercise, which is stunning. In my day, and I'm going to sound like one of those old, okay boomer, kind of guys, but we had TV. We had 13 channels, which were all black and white and fuzzy. And, we go out and play hockey after school or throw a ball. Or we were always out being active. I walked 2 miles, half a mile up to school, come home for lunch, all that kind of stuff. And I look at the kids now and it's like, well, I need to have a car ride 2 blocks down to the store to buy my sugary pop and my chocolate bar or whatever, so I can go back to the house and sit in the dark and play my video game. And,
I got one of those at home.
I've been guilty of that too, the helicopter parenting and all of that stuff. But, we really need to stop and ask ourselves, what are we doing? And that's really what it comes down to. And, I've talked today quite a bit about the real problem. It's time that we start like looking in our own backyard at what is the real problem and what are we doing to cause it and what can we do to maybe fix it? Because there is still time for the younger generations for sure. But at the moment, we're going in very much in the wrong direction.
Well, Stephen, thank you for all the, I guess, the advice and the opinion and the different, items here or suggestions. I think there's value. Ultimately, some people may see it as controversial, or maybe they will not see, that it's even viable. But at the end of the day, there is definitely a need to look at it, to address it. There's definitely a need to have a different, outlook into the healthcare system as a global piece, or as whether the two nations. We might be onto something already. As I mentioned, some of the concepts, what you said, there's nothing wrong with profit. Like for example, I work for a company that is for profit. It's an insurance, provider, but they do only government programs, which is completely subsidized by the government. So there is a hybrid, and the core value of the mission is to provide to those that qualify. And that's the thing. The key word is qualified, not all. They'll get the quality, healthcare, the preventative, they have access to whatever they need. So it is a limited, concept, but maybe you've taken that and maybe elaborate more and maybe even enhance it, to make it a bigger and broader and more robust, formula. That may be the case. We're not solving the issue here today, but certainly there's hope that, and we should look at the hope and the potential to change things. To your point, next generations are going to have it rougher and tougher, not only to the point because of their lifestyles, but also just everything is more expensive. And there's also trends. I mean, a lot of folks, an older generation would work at an early age and so on and so forth. Some of those folks today don't want to do that. To your point, they sit at home comfortable. They don't feel like going out, and they get everything. So everything is going to be pushed a little bit difficult, and it's going to be more difficult for the generations to come, unless something is done about it. And hopefully, we'll see that they come sooner than later. In light of everything that's going on, maybe the eyes are opening and people will see. And we've seen good examples. People come together for a good reason and good, cause. And maybe this is a good cause where people have to start looking in a different light and different angle. That will be my conclusion. Any last remarks?
Yeah, I want to leave on a positive note and just remind people. I tell my clients this all the time because I do a lot of crisis management. A crisis is just an opportunity in disguise. So, we're dealing with an almost unprecedented crisis, although frankly, not only 1918, but as I say, SARS, MERS, and H1N1, we've been to this movie before. But this crisis can be an opportunity and can help us almost like as a springboard to positive change. It's really up to us. We choose how we react. And I would simply say that if we can just be honest with each other and stop all the rhetoric and really get serious about fixing the real problem instead of the political problem, we're smart. I've got great confidence in all of the generations. I believe that we can solve these problems. These are all fixable. Everything I suggest in my book is doable. But we just have to get serious that it really is a problem and that now is the time to start doing something about it. And as I say, COVID might be looked upon years from now that was the silver lining because it was the catalyst that got us going down the right road. So let me just end in a most positive way possible. People can do this. And was it Nike says, just do it. So gang, let's just do it.
That's right. And we can, I think, and we will. Again, it's timing and just finding the right folks to do it. One last thing, the book, This Might Hurt a Bit, is available on Amazon, I'm assuming, and other platforms.
Yeah, it's amazon.ca, amazon.com. It's available in a bunch of bookstores. It's pretty easy to find. Again, it's This May Hurt a Bit, Reinventing Canada's Healthcare System. And if anyone's interested in other things I've done, I'm all over social media. There's like lots of pictures of my mug or my voice or my writings or whatever it might be. And I try to make it as entertaining as possible. So I'm easy enough to find. So, and again, I'd be grateful. I mean, I say every Canadian, every American should read the book, and I know that won't happen, but I'm certainly not getting rich off the book. So it's not for that reason that I'm saying it. But I really think you should look at what I have to say, because I'm one of you. It's as if one of you wrote the book. Okay. If one of you had been put in the position I was 25 years ago, this is what you'd be coming in and talking about. So from that point of view, it's something I think you'll enjoy and get a lot out of.
All right. Well, Stephen, thank you for joining us on the show today and for, accepting the invitation. And, it's been enlightening, and it's definitely, I think, a good dialogue and a lot of insights. For our viewers and our listeners, thank you for watching the iHealth channel and listening on iHealth Radio. Hurricane H here with our guest, Stephen Skyvington from Canada, writer and author of the This Might Hurt a Bit book. Check it out. And any comments, suggestions, please feel free to send them to the station, and then we'll probably, maybe if you want them back, and maybe we'll have a debate. If someone wants to actually have an actual roundtable, we can have a few people actually come on, and maybe providers and legislators, and maybe we'll have a little discussion. We're always welcoming, new ideas on bringing. Again, this is a platform for health, and we should all come together to discuss, something that's dear to us. That being said, have a great day, have a great weekend, and of course, we're still just a couple of days after New Year. Happy New Year, and let be the New Year, a better year than the previous ones. That being said, have a great day, and talk soon. Bye-bye.